Let's talk Genu varus, aka bow-legged knees. I'll keep this simple with a three-part breakdown. Causes. In babies and toddlers, bowing can be totally normal. Most kids straighten out by age 2 to 3. If bowing stays past age 3, gets worse, or is asymmetric, it needs a closer look. Physiologic bowing. Blount disease. Proximal tibial growth disturbance that can worsen without treatment. Rickets from vitamin D deficiency. Skeletal dysplasias. Previous fractures that healed crooked. Obesity increasing medial knee load. In adults, long-standing alignment issues. Osteoarthritis. Old ligament injuries, especially the lateral structures. Meniscal loss. Examination. I start with the gait. Do the knees arc outward? Is there a waddling or varus thrust with each step? Alignment. Feet together, kneecaps forward, measure the intercondylar gap. I check hip rotation to make sure the issue isn't coming from the hip. I palpate the medial joint line for tenderness. Stability testing. Varus stress at 0 and 30 degrees to assess the lateral-collateral complex. I look for limb length differences. Patellar tracking. Foot alignment. Flat feet or high arches can shift forces. For kids, I plot growth and watch for asymmetry or progression. Imaging. In kids with persistent or asymmetric bowing, standing AP radiographs can show metaphyseal changes for Blount disease. Labs may screen for rickets. Adults often need full-length weight-bearing alignment films to measure the mechanical axis and joint space, plus MRI if ligament or meniscus damage is suspected. Management. For physiologic bowing in toddlers, reassure, observe, optimize nutrition and vitamin D. Recheck alignment. Blount disease in young children may respond to bracing with a knee-ankle-foot orthosis. Severe or older cases may need guided growth. Or osteotomy. Rickets, correct vitamin D and calcium. Treat any underlying malabsorption. For adults with mild varus and early symptoms, weight optimization, activity modification, quad and hip strengthening, foot orthotics or medial unloading strategies. Short courses of NSAIDs if appropriate. Unloader braces can reduce medial knee load during activity. In cartilage or meniscus-driven issues, targeted procedures, like meniscal root repair, may help. When arthritis is advanced, surgical alignment procedures come into play. High tibial osteotomy to shift load laterally in active patients. Or knee arthroplasty when joint damage is widespread. Red flags to act on fast. Progressive asymmetry in a child. Severe pain. Systemic symptoms. Sudden worsening after injury. Bottom line, Genu varus is common, often harmless in toddlers, but in persistent, painful, or progressive cases, a structured exam and tailored plan make all the difference. Take notes, get proper imaging when needed, and treat the cause, not just the look. Causes, examination, management. With the right plan, most people move better and feel better. Work with your clinician to personalize care. Thanks for watching.